Namaskar and thank you for joining. So today we are going to discuss about the green leafy vegetables and legumes, what role they play in prevention, control, and reversal of blood pressure, diabetes, cholesterol, heart disease, and stroke and cancer. You remember the previous video we had shared about the fruits and whole grains. So first of all, let me remind you I hope that all of you have these 10 pillars of DASH lifestyle intervention put on your fridge with a magnet to remind you every day what we're talking about. And number two is this, our 10 principles. So we did the first two, now we're doing the second two. And please make sure you print it out and put it on your fridge to remind you every day. So how do green leafy vegetables protect the heart? You must be wondering. There's so many medicines, stents, bypass, so many things you do, and they're all very good. They all help. But you should not ignore the help of these food ingredients. Using food as medicine is the wise way. So they're all rich in nitrates. And if you remember, some of you who may have heart disease, you use nitroglycerin, nitrobid, right? All these medicines have nitrates. These nitrate medicines are the one which become nitric oxide. And nitric oxide is the one which really opens up the arteries. So those of you who may have blockage, right? And their doctor may have prescribed either sorbitrate or nitroglycerin to put under your tongue. So what does that give you? It gives you a large supply of nitrate. And the nitrate then opens up your blood vessel and your chest pain goes away and the blood pressure drops. Same nitrates in small amount every day you can get through green leafy vegetables. Second thing is they're very rich in antioxidants. See, every day we are metabolizing, body processes going on, and there are toxins accumulating in our body. And I keep saying again and again and again, some of you like to lead a lifestyle which is pro-toxin lifestyle. And then every 2 weeks you go somewhere in some resort place or some wellness center and you go through the entire detox, naturopathic detox and Ayurvedic detox, which is very good. It's very effective. It works. But if you are eating the diet that we are talking about every day and living the life that we are talking about every day, you don't need detox because our diet is antioxidant diet. Our lifestyle is antioxidant lifestyle. It is pro-healing diet. It's pro-healing lifestyle. It's anti-inflammatory diet. It's anti-inflammatory lifestyle. So there are no toxins accumulated in your body, and therefore you don't need a detox. Okay? If you do what you're saying. Now, I talked at length about the fibers in the last video. Fibers, how fibers delay the absorption of sugar and they improve your blood sugar, how fibers protect you from constipation, bloating, and colon cancers. So all that is also pretty much there in green leafy vegetables. Then micronutrients, potassium, which drops your blood pressure, magnesium, which helps your blood vessels and nerves, folic acid, vitamin K1, they all improve your body functions. And fiber also help you lower lipid profile, lower your cholesterol and triglycerides, and reduce inflammation. All green leafy vegetables have low calorie density. What we mean by calorie density is if you take a glass of milk, right? In that one glass of milk, there may be 200, 300 calories. So they're very dense. You just gulp it, and in 1 minute, you have 300 calories. But to eat 200 calories of green leafy vegetables, you will have to eat two bowlfuls of leafy vegetables. And this will be absorbed slow. It'll take you time to eat that. So the calorie density is less. And that is how they help to improve your glycemic index. And that's how they prevent your diabetes and improve your insulin resistance and make you insulin sensitive. Now, they also improve endothelial function through multiple factors. One, I told you by availability of the nitrates that directly improves endothelial vasodilatation. It also reduces inflammation that improves endothelial function and also lowers cholesterol that improves endothelial function. So see, you're taking all these medicines and you learned about how the blockages form. And I told you it begins with endothelial dysfunction, then the cholesterol comes in and then inflammation comes in. But green leafy vegetables is acting on all three. So your every day, with every meal that you take, full of green leafy vegetables in the proper way that we'll talk about, you're improving your heart function, endothelial function, inflammation, cholesterol, blood pressure, natural treatment of blood pressure, cholesterol, heart disease, cancer, obesity. So what's the evidence? This is a very large study, and in many, many videos I quote this nurses' health study and health professional study. Why do I quote this? Because this has been the longest running study. It's almost 30 years old now, and there are over 250,000 nurses and healthcare providers participating in this study. And they fill up their forms, fill up the blood work, just like you are in my life program and you check your blood works and you do all that. They keep a log of all that, and they've kept that over the last 20, 30 years. So it's a very, very robust data that they have from these people. People that eat green leafy vegetables more than two portions a day have 16 to 20% less chance of heart disease. And again, same in the studies done on the DASH diet and the Mediterranean diet, both said there's strong evidence of BP reduction and heart attack prevention with green leafy vegetables. We talk about Dean Ornish trial, which showed a regression of the plaque. Actually, he demonstrated angiographically that blockages shrink and become less. And he also used a plant-based diet, which was rich in green leafy vegetables. And then there is a epidemiologic meta-analysis. Each 100 gram per day of green leafy vegetable reduces heart disease risk by 20%. Now, there are some vegetables that are naturally nitrate rich. Spinach, kale, which I know you don't get in India, but you get in America. Arugula, you don't get in India. But there are salads that you get in India, spinach, other leaves, mustard leaves. There are many leaves that you get, those green leafy vegetables. And they all dilate the arteries and improve vascular function. So what's a practical way? Choose multiple greens. With one and eat it every day, you will get bored. Multiple types of green salad, green leaves that you can eat. Prefer to steam them or lightly cook them or saute them. Do them in raw in salads or smoothies. That retains the nutrients. When they're combined with whole grain legumes and fruits that we talk about, there's a joint effect. It's called synergistic heart protection. So 10-20% from the legumes, 10-20% from the green leafy vegetables, 10-20 from the proteins, fruits, and 10 or 20% from whole grains, they all act together. Avoid putting cream, oil, butter, frying, or too much salt in it or sugar. At least 75 to 150 grams of cooked raw vegetables daily you should eat. The more you eat, the better, if you can tolerate that. So one simple way I tell you, this is what I used to use. You can actually, if you cannot eat vegetables with your meal too much, there are many ways to maximize. The easiest is to make a smoothie. Have green leafy vegetables, put a carrot, put a couple of tomatoes in it, put ginger, about 10-15 grams, a green chili if you like it hard, tomatoes, two slices of apple, and lime. And just stir it, run the smoothie. Delicious smoothie. So it has the greens of all the leaves. In addition, it has lime, green chili, tomato, carrot, apple, all these added ingredients. And a glass of that, you can almost eat 150 gram smoothie in just one glass of green smoothie. So you can do it that way. You can also eat in a form of salad that you're doing, right? You can also make a soup. So the best way to do that is make a soup with green leafy vegetables and then you run it in a blender. So all the green leafy vegetables get blended with this. So in that soup, you can put in carrot, you can put some potato, you can put in tomato, you can put in green leaves. And again, you can put some onions and you can put ginger and you can put green chilies, you can put coriander, right? And your own seasonings and flavorings. And then you make a soup and run the soup in a blender. So it's all blended. So it's like a smoothie, but it's hot. So smoothie, good in summers, soup, good in winter. Or you can lightly saute them, mostly water, very little oil, stir fry in a pan, and they're ready. In 5 minutes, you can saute cauliflower, peas, and those kind of things, and as a salad. So there are many ways you can maximize your green leafy vegetables. Try different combinations, see what you like. So what is the science? The science is they are rich in fiber, and fiber lowers the LDL and improves lipid profile. So people that eat green leafy vegetables have a chance of cutting back 5 to 10% on their cholesterol. See, 5 to 10% lowers when you switch to whole grain. 5 to 10% lowers when you take legumes that I'm going to talk about. 5% lowers when you take almonds, 5% lowers when you take fruits, and 5% this. So almost 25 to 30 to 40% LDL you can lower by these four changes in your diet. Fruits, green leafy vegetables, whole grains, and legumes. Now they also have isoflavones and those phytochemicals that improve endothelial function. They have low glycemic index, so they stabilize blood sugar, improve insulin resistance. So green leafy vegetables improve diabetes, so your need for insulin goes down. Now you must be wondering, Dr. Sharma, I eat vegetables. No, you kill them by frying them. You kill them by adding cream to them. You kill them by putting oil, butter. That kills the green leafy vegetable. They are dead. Any benefit that they had is counteracted by adding too much fat with it, too much salt with it, too much oil with it. So be careful. They are very rich in micronutrients that improve your blood pressure and improve blood vessel health. And they also fill you up faster. So when you're eating salad before meals that we recommend, you eat less. When you eat less, it's good for your weight management. Okay. Now, these are all the studies from the for the legumes. And multiple studies have shown that eating legumes, just like green leafy vegetable, lowers 10 to 20% of your risk of heart disease. Again, if you take soy protein with legumes, your protein requirement is done, and it also lowers your cholesterol by 5%. So have at least half to 1 cup of cooked legumes every day. So what do I mean by legumes? Lentils, all dal, जितनी भी दाल है, काली दाल, पीली दाल, orange dal, black dal, all the lentils are legumes and very good for your heart health and vascular health and blood pressure, and good source of protein, good source of fiber. Chickpeas, kala chana, safed chana, green chana, black beans, pinto beans, kidney beans, red beans, soya, and peas, butter. Do you know peas are rich in protein? Some of the you have seen these young people crazy about proteins that they take. I go to gym and I take protein. They recommend a different protein. Most of them are doing whey protein, but some are smart and they do plant protein. Do you know where the plant protein comes from? From peas, matar ke dane se. So what you can do is you can buy those fresh frozen peas, keep them in your fridge, and your salad you can add peas. When you make your sabzi, let's say you made gobi aloo, you add peas to that. You made mixed vegetable, add more peas. Pea is the best source of protein. You know, they just did a study, actually, it came out a week ago. In America, they interviewed doctors, cardiologists, and said, why don't you recommend whole food plant-based diet to your patients? Now, there are many, many reasons they said. But one of the reasons they gave, 28% cardiologists said that plant food is low in protein. So think about it. 1 in 4 cardiologists doesn't know that lentil, chickpeas, black beans, kidney beans, soya, peas, they're loaded with protein. So if you're eating plant diet, so I tell you one best way to do that is you snack on beans, right? Chickpeas, bhuna chana, or you can do boiled chana and you can make a chaat, right? So there are many different ways you can maximize your legumes. You can also put peas in a salad, put in a soup, put in your curries, stew. You can also eat them in the form of hummus, or you can use a lot of soy products, tofu, tempeh. They're loaded with protein, right? And don't eat red meat, processed meat, legumes for protein. None of the people attending my program should ever have any doubt in their mind that if they don't eat animal food or dairy, they're losing on protein. They are not. And I shared with you many, many times, almost 75% of Indian cricket team is now vegan. I told you about Virat Kohli, the most agile athlete, vegan. He doesn't even take milk, let alone animal food. So plant protein is the best protein, is complete protein. So how to maximize legumes? Just some tips. I told you you can do two things. Number one is buy these fresh frozen peas and keep them in your fridge. And you can also at your home boil the chickpeas, safed chana. Lots of it. You can do a cooker full of that. And you can freeze them or you can put them in the fridge. So when you're eating your salad, you put a handful on top of that. When you made a mixed vegetables, you put a handful in that. Okay. So you're snacking, you add some chickpeas to that. You can make hummus with chickpeas. So tons and tons of protein you can take by using judiciously peas and chickpeas with every meal. I love chickpeas. I love their taste. Kala chana, safed chana, green chana, I love them. And hummus. That's the best thing to put on your slice of bread, your whole grain bread, put hummus on that. Homemade hummus with chickpeas. You can put a little bit of sesame oil and you can put lime and you can put black pepper. Beautiful hummus. So maximize your legumes. All right. So legumes and green leafy vegetables, two we talked about today, and whole grain and fruits. So I told you minimum 2 to 3 fruits. I eat 4 fruits a day. Green leafy vegetables should be with each meal, along with salad with each meal. So that gives you enough 4 portions of green leafy vegetables a day. Then change your bread or your rice or your grain to whole grain or millets. So that gives you all whole grains, right? And then legumes. So you're already doing legumes, black gram with your breakfast, right? You can do one more dal with lunch and dal with dinner. So lentil protein, right? And then you can maximize protein if you're worried about in not getting enough protein by, as I told you, frozen peas and frozen and boiled chickpeas you keep and you add them to everything. Add them to salad, add them to soup, add them to vegetables. So every vegetable that you make, you pick up a handful of boiled chickpeas and put in there, and put a handful of peas and put in there. You have got same eating a piece of meat or chicken or an egg, more than an egg. Egg gives you 5 grams of protein. One small bowl of chickpeas gives you 10 to 15 grams of protein. So we eat one small bowl of chickpeas, right? Safed chana. It is like you ate 3 eggs. So know this, know the facts, and then live accordingly. All right, so I'll stop there.